Healthcare is really interesting because with the advent of electronic medical records, EMRs, everybody felt like, oh my gosh, this is the panacea, we've now got everything. And what they didn't realize is that the paperless office isn't here yet. Certainly here in Kentucky, the people who travel from rural parts of the country with medical files this tall, where they want to come to Lexington to get their medical treatment, having that information incorporated in their medical record is not necessarily something that was well thought through. Having access by multiple different entities was not necessarily well thought through. In some of the larger medical practices where they have offices around the state, they really struggle with the lack of portability of their records and their files, whether they're in their EMR or they're hard-coded, because the EMR is here in Lexington and they don't necessarily have high-speed internet where they're going. So if they haven't remembered to pack everything for everybody they plan to see and have some way of getting the information for the patients who walk in that weren't expected, they've got a problem. So the whole notion of having an infrastructure that allows you to briefcase the data from your medical record system, as well as the paper records and your scan records and your radiology records, and have that available on your tablet so that you can make updates on those items and have them then be pushed back into the medical records when you get back, is huge. And finally, one of my pet peeves. I don't understand why we have not fixed this. Every time I go into a doctor's office and they give me a clipboard and they want to know my name and my address and my medicines, I always think to myself, so if there was a tablet and they put in my medical record number, it would pre-populate all these fields. And I could simply scroll from page to page and uncheck and check to make changes to that. And my experience would be much better, as would be theirs. When we talk to major doctors' offices, they talk about the kind of labor associated with managing that process, including and especially helping people fill those things in. So there are a lot of opportunities in the healthcare field.